Hello, sir. I am Farshi from Kerala.
Okay,
Uh,
hello Farshi.
Hi, sir. So, thank you so much for doing this. And I've
Mm-hmm.
been following you before your takeover on Instagram on
Okay.
Resident. So, yeah. So, this is like really helpful because usually we see all these takeovers. It's just those selected set of questions that they ask. I mean, people ask, and
Uh-huh.
I usually, by the time I've sent a few questions, but I've never got anything answered because before that itself anybody will ask that. So this is a
Mm-hmm.
more personalized one. So thank you for this first of all.
Okay,
uh,
my pleasure. Yeah.
yes, sir. So I am a 2020 graduate, and
Mm-hmm.
I have a huge red flag that is 2 years because
No, no, no. I don't think. First of all, let me correct you. I
yes, sir.
told you like we are like we all are average people, and if you consider 2 years as like red flag, I already had 2 years red flag. Like I graduated in 2019, and I was applying this year, like
Oh,
last year. Sorry, like so this cycle was that. So I had like 3 years thing.
yes, sir. But then I didn't do anything else. That's my problem. I started my preparation and I had a downfall and I had to step back from my preparation,
Mm-hmm.
and then I restarted. And now I'm planning to give it in July or August. In 2 months, I'm planning to give.
Okay.
Just want to, like, I'm a graduate, so I just want to ask you about the sub internships at Stony Brook. I had texted you on Instagram and you told me like you'll help me with it. Thank you so much for that. You've always been kind. So can you like tell me more about your Stony Brook sub internship, please?
Okay, so let me tell you about my experience. So I did like for 3 months over there. I was there for 3 months, 3 months internal medicine. That's like a I really like that program, and I asked the program's leadership about like I really like your program and I want to rotate in this. First, I was in internal medicine floor team, 1 month floor team, and then I got into night shift team and also ICU. So these were like the prime things I wanted to learn from there. And sub internship is basically like an intern. So in India, like in your internship, have you seen like your they like the president make their team? So my team was like team three, and in that they have one senior and three intern. So three first years, one was TY transitional year, two were internal medicine interns first years, and one was second year or third year, that is senior, and three students, one, two, three. So two were American grads and one was IMG, me. So they assign like first day, it's like you get everything, like you get access, like you get your own badge. I'll show you mine if you excuse me. Just wait a minute. Okay, so this was my card. So they'll give you like this. So this was my card, and like there's this panda on this, and with this, like you can access any corridor, anywhere, like emergency, you can go anywhere, and you can access lounge, resident room, everywhere, with cafeteria also. So like sub internship is kind of like you are a part of a team. And what so senior used to do, my senior used to do one thing. So first day was like basic introduction of like, so this is our floor, this is everything, and how we present the case. So he taught us about like everything. And then next day he assigned me one patient. Okay, so I have to follow that patient. We used to go in like in the morning at 5:30 a.m, and we used to come at like 5 p.m or 6 p.m in the evening. So it was full time working as a resident. So sub internship means like you are working under an intern. Intern is a resident. and you have to present that case to the attending. So you have to go through the charts, you have to take the thorough full history. And first day, like second day, he asked me to present the case to the senior, and then third day he was like confident this person can present. Third day I was presenting that case to the attending. So attending will ask you everything about that patient, like just like first history, and then like what kind of medication is he taking, and then labs and everything. So everything that a resident should be doing, you'll be doing that. And you won't be like ordering medicine in the initial, and you just have to like suggest them, like in my opinion I think this should be done to this patient. And your attending or resident or senior, they'll actually like correct you or like praise you, like, oh nice, you are like you are learning a lot, or you're doing better, and you're on top of things. And in the afternoon also they used to have rounds. So in afternoon you have to take like you have to follow up everything, like what we did in the morning, and what orders did we put into the system, and did she like nurses executed that thing or like that order to the patient. And then following the patient about like his like afternoon labs. So it was like everything was there, and you also have to write the summary of the day, and your senior will check that and correct you on few things. So that was the experience, like everything as a intern you as an intern you do. So they teach everything like that.
Okay, sir. So how did you secure that sub-internship at Stony Brook, sir?
I contacted the student coordinator at that program, and she was very kind. And like I actually asked her like a couple of months back, and she responded like, "We have one position opening up, and would you like to join?" And I was like, "Yes, why not?" And it was in the month of like, so November. So last year November, when I was like going through my interviews also, and I could not upload the letter of recommendation from that program, but I thought like, okay, this is gonna like this will be a game changer. Not a lot of people are actually doing rotations right now. If I'm doing right now, that means like that will I'll be able to talk about these rotations to the program directors who are interviewing me, who will interview me. So that way it actually helped me.
So, sir, like if I want to get in for these sub-internships, I should be sending an email out to the student coordinators, like
Yes,
wherever.
student coordinators. And like if you have any friend who or like a lot of times you can find student coordinators email on the websites, like Frida, you can find on Frida is a website. And from there you can like search the program, and then search the email ID or like phone number also. I used to call also. Skype calls. So
Are we allowed to do that, or should we ask for
yeah, no,
permission?
no, no, no. You can call. You can call.
Oh, okay.
Call their not their personal number. The number they have mentioned in the Frida, that is like the official number, and that's the program coordinator's number. So sometimes you can call. Sometimes if you're not like if they're not responding to your emails, you can call. But
Oh,
don't call like on in the odd timings. Like try to call at this time or maybe before that, or 7 p.m. in the Indian time, so that like that will be 9 or 10ish in the America, or 11 in the morning, because in the evening they don't take the calls. And also don't call them on weekends, like Saturday Sunday, that's off for them, so don't call.
okay, sir. And then, sir, just one more question.
Mm-hmm.
What, like, it's been 2 years since I've taken a case. So, like, what textbook should I buy? Because I'm planning to go to US soon after my step one. So,
Mm-hmm.
I just a textbook to learn the history taking from scratch. So, can you like recommend?
I'll teach you. I'll actually like make a video about it. I know like
Yes, sir.
my seniors actually like taught me very thoroughly about history taking. And that's like the best way of like they call it as SOAP, subjective objective assessment and plan. SOAP method of presenting a case. And I have like written everything. I'll just make a small video and explain everything, and you can actually like practice that case presentation here. And also like you can do that in America. You don't need any textbook or anything. It's a very simple thing. People complicate things. Things are simple, they complicate just to scare you. So I'm just telling you, it's a very simple thing. SOAP, there's one page that I have made in my sub internship. I'll share that with you, and I'll also like make a YouTube video. Right now I don't have time, but probably like within a week or maybe 2 weeks, I'll make that video. Just remind me that. So I'll upload that and you can learn from that. And if you have any question, you can also like text me or like text me on this group.
Yes, sir. Yes, sir. One last question. I'm really sorry I'm taking up
No,
all
no worries, no worries.
Sir, I don't know if this question is stupid, but like this sub internship, is it only for the university hospital or for clinics also? Is it
No, no,
there?
no. So let me clarify one more thing. Clinics. So if you're doing any kind of rotation at clinic, I would like strongly discourage you doing that.
Oh.
Clinics don't have any sub internship or clerkships, because at clinics they'll be managing chronic cases, like who like a person is coming for diabetes medication or hypertension medication. They're not dealing with inpatient admissions or like treatment of critical illnesses. So you won't be working under a team or working under a resident or resident team or attending team. You'll be just interacting with the doctor who is running this clinic, and just like taking orders from him and then like doing things. So that is like, maybe you can call it as an observership or externship, but that is not like the good way of doing USCs. So try to focus. So all the only hospitals can offer you sub internship, because residents are basically in the hospital, not in the clinic. Okay.
Sir. That I didn't know till now. Okay, thank you so much, sir. Thank you.
No worries. Okay.